Hello and welcome to our Kinepict knowledge-based podcast. I'm Szabolcs Osváth, the CEO and co-founder of Kinepict. Today we are happy to welcome Michael Branagan Harris from Device Access UK. Hello, Mike, and welcome.
Hi, everyone. It's an absolute pleasure to be invited to be on this podcast. It's wonderful working with you guys at Kinepict over the last few years. And yeah, it's great to be invited. Very happy to be here.
Could you kindly introduce yourself in a few sentences to our audiences?
Yeah, so I'm Mike Branagan Harris. I'm the founder of a UK-based company called Device Access UK Limited. Our goals are to get great technologies to patients faster, medical technologies and diagnostics. And we've been around for 12 years and we've helped hundreds of companies accelerate their speed to market in the National Health Service, which is our publicly funded healthcare system, otherwise known as the NHS. It's a very large healthcare system that employs many people, but it's probably the largest healthcare system in the world, and it's quite a complex one. So what we do is we help companies navigate their way into the NHS. My background, I've been in medical devices for, and market access for 30 years. So I've spent 20 years introducing many technologies into the NHS, including gastric bands, endovascular grafts, robotic surgery, and I also introduced a treatment which transformed the way that varicose veins were treated in the NHS. It's a treatment called venous closure, and that actually taught me what I'm doing now is how do you get a publicly funded healthcare system on a national basis, or any healthcare system on a national basis, all back a new technology, all recommend it as the best option for patients. And that's what we do here. We've got an amazing team of people, health economists, data experts, ex-NHS managers, and we've also just hired somebody from NICE, and NICE are the organization that assesses new technologies and promotes them if they are clinically effective and cost effective. So a lot of the work we do here is making sure that we give NICE, who are the organization who assess new treatments, the right information for them to make a positive decision on new technologies and help to promote that new technology across the whole healthcare system. And that's why we're working with you to help you at Kinepict in doing this work and helping you to put your product together in a very good proposition for our healthcare system. So as I say, I'm very pleased to be here and delighted to be part of this podcast.
Yes, thank you. And I can testify that, yeah, your work, since we worked together, was very useful for us. I mean, we've done together with you the health economic study for Kinepict, and you and your experts could actually quantify in terms of budget all the benefits our product brings, like X-ray dose reduction and savings on contrast media.
Absolutely. And, this is exactly the sorts of things that our healthcare system is looking for. The work that we've done together is about turning all of your benefits of this great technology you have to reduce, contrast and to optimize images, has such interest for the healthcare system here because, like many healthcare systems across the world, we've all been affected by COVID-19, and in addition, all healthcare systems in the world don't have bottomless cash, right? There's the money is limited in all healthcare systems to a certain extent, and ours is being publicly funded. So it's all about value and turning what you're offering into a great proposition for our healthcare system. So yeah, the work that we've been doing together and the services that we've been providing is really backing with the health economics, showing that reducing radiation for angiograms is a very favorable thing for the NHS in many respects, and the health economic modeling was very favorable as well. So the other things that we've been working on is trying to sort of understand, how the NHS would go about adopting the system, and making sure that we provide the doctors and the experts and the key opinion leaders and the stakeholders in hospitals with the right information, so that they don't have to spend hours writing these reports and dossiers, or business cases, as we call them here. If a doctor sees something he likes, he has to make a case for it, and that can take a long time if he's not given the right information and doesn't have it in the right language and NHS language to be able to get that technology purchased and procured. So a lot of the work we've done, besides obviously showing the favorable health economics for the system, it's about, okay, so it's shown to be good value. How do we then get hospitals to buy this? And that involves, as I say, business cases, budget impact models. And the other thing that we do here, and I didn't talk about it earlier, is that some of the work that we do is truly trying to understand how the NHS treats their population. And the NHS, being a publicly funded healthcare system, do collect a lot of data across all of the sites. So all the patient data is collected. And what we do at Device Access is we have access to that data. We have a special license because of the success of the work that we've done over the last 12 years and getting over 50 new treatments through NICE. We have special permission to access patient level data. What that means is that although we can't identify each patient, we're able to look and see how hospitals are treating patients. We're able to see what the outcomes are like, how long they were treated for, length of stay, readmission, the cost of the episode, how long the patient waited, the primary diagnosis, and all the other comorbidities that may have an effect on that absolute episode of care. So the work that we do is, and we've done with you, is helping to look at the NHS, to look at the whole of the system and understand where the Kinepict system would benefit, make the biggest benefit, make the biggest case for adoption. And so a lot of the work we've been doing is getting a proper landscape of the opportunity for better outcomes using the Kinepict system, by understanding the outcomes that are going on at the moment and how patients are treated in the system. So yeah, it's been a really great time working together with you for about a year now. And yeah, this is the sort of stuff that we're able to do at Device Access to help companies like yours to succeed and get this great technology to patients faster.
I mean, in your health economic study, you showed that we produce 300 to 600 pounds savings for the society per patient by the smaller number of complications as a result of the intervention, and due to the decrease in the expenses. And the next step, if we understood correctly, is that we set up several reference sites, reference hospitals in the UK. In particular, we have discussions with 3 hospitals: St. Thomas and Guy, Northwick Park, and St. Mark's Hospital. And then we would like to produce evidence based on the workflow in the United Kingdom, and together with these medical doctors, to provide more evidence for the NICE application, and to move on to get into the British system.
And that's really good that you've made some very good progress in some very not the easiest of accounts, but certainly some very globally renowned sites, in central London. So I commend you on your commercial success so far in getting those sites interested, because many companies would be very interested in getting into those sites. So congratulations on your success there with your team. Yeah, that's really good, and congratulations.
I think many companies would be interested to hear the workflow and what's the best approach into the NHS system. Would you summarize it in a key bullet points on what to watch out or consider for?
Work that we do here is very different to many companies' normal journey of getting technologies into healthcare systems, and that's using marketing. And although marketing has its place, I think when it comes to groundbreaking technologies like yours, the value proposition of what you're trying to achieve has to be put together in a different way. So there are the principles of market access, which we've come up with, which is basically very different to marketing. Marketing being product, price, place, promotion. Product, price, place, promotion is the principles of marketing. We're about the principles of market access. Principles of market access are about demonstrating that new technologies benefit patients, benefit the hospitals that use them, benefits the payer who pays the hospital to treat the patient, and for the product itself has to be priced in a way that is good business to the manufacturer. So if you are thinking about bringing other companies bringing technologies into the NHS, the sorts of things that they're looking for when it comes to benefits for patients are things like reduction of mortality, avoiding tests, procedural or unnecessary treatments, reducing risks, side effects or complications, enabling patients to have earlier and more accurate diagnosis, reducing the need for further treatments, increasing self-management, reducing adverse events, preventing a condition incurring or exacerbate or getting worse, and enabling a test, procedure, or treatment to be done non-invasively, but above all, improving the quality of life of patients. So they're the sort of things that the NHS are looking for in medical devices and diagnostics for the benefit of patients. When it comes to hospitals and care providers, particularly hospitals, you know, they are businesses, and at the moment many of the hospitals have got very long waiting lists because of the shutdown of the system or partial shutdown of the system during COVID-19. So they're all about performance, and performance means getting through the waiting lists, ideally moving patients into day case. So having patients leaving the hospital the same day is a big driving force of what the NHS are looking for. Keeping people out of adult or pediatric intensive care. Reducing no staff or lower grades of staff, above all, reducing the length of stay and enabling patients to leave hospital sooner. And they're the things that hospitals are looking for in our healthcare system. And then, of course, you've got the payer of care who fund the hospitals to do the activity. Well, being payers of care, you know, if they can reduce emergency admissions, that's great, because emergency admissions cost the health system a lot of money. They're disruptive. So anything that reduces emergency admissions or readmissions, they're looking for better compliance, whether that's people not smoking and not having diabetes or whatever. You know, compliance is a benefit, better compliance. They want to reduce referrals. So if a treatment means that they don't come back again, that's great for a payer of care perspective. And then moving patients into primary care, which is cheaper than being in secondary care. So again, helping patients to leave hospital and go to live near a home to be under the care of their GP is a good thing. Anything that leads to fewer appointments and is cost saving is the sort of thing that the payer of care is looking for. But again, as a company manufacturing these technological breakthroughs like you have, you know, it's about optimizing your selling price. You know, you've spent a lot of time and money in developing the solution. You should be able to sell it for as much as you can, and have a sustainable price as well as a justifiable price. And so pricing is so important, and that's part of the work that we've done with the health economics, is to justify the price, to show that it is affordable, to show that long term the solution is you know, is effective, it's affordable, and it's good long term. It's not just short term, it's the long term outcome benefits of new treatments. So they're the sorts of things that the NHS are looking for. And it's been great working with Kinepict, because they've come up with a solution that I think the NHS will embrace and be very interested in. And that's what it's about. It's about you know, those four principles: patient, provider, payer, and product benefits, that I recommend that companies think about if they're thinking about bringing a technology into our healthcare system, or indeed any healthcare system. It's important that it's not just it's cheaper is not always the best thing for a healthcare system. It's about better long-term outcomes and good things for patients as well. So as I say, it's been a pleasure working with you in helping to develop this solution for our healthcare system.
Sadly, our time is up. But just before we wrap up, if someone would like to get in touch with you, what would be the best way to do that?
Oh, thank you. Yeah, so you can find us on LinkedIn, Device Access UK. We're on LinkedIn. The website is www.deviceaccess.co.uk or deviceaccess.iges.com. But you'll find us on LinkedIn under Device Access UK Market Access NHS on Google, and we would be delighted to have a conversation with anybody interested in going on this journey as well. My email is mike@deviceaccess.co.uk. I just wanted to say thank you for being invited again onto this podcast, and wishing you and your team, Szabolcs at Kinepict, continued success in commercializing your solution into the healthcare system, and looking forward to catching up with you next time.
Thank you very much. And thank you to all of you, our listeners, for joining us today. And a big thank to Mike from Device Access for sharing his insight and wisdom with us. As always, if anyone has any questions or comments about what we have discussed, be sure to get in touch with us. We are looking forward to catching you all next time. Bye-bye.
Bye, everyone. Thank you.
Bye-bye.